Good morning, all. Today we'll see a topic that comes under fundamental of nursing. That is an interesting topic, comfort devices. First, we'll see what is meant by comfort devices. Comfort devices are the articles that will aid comfort to the patients or relieve discomfort, and this will maintain a good posture or position for the patient. So, what is the functions of or purposes of the comfort devices? This will relieve discomfort and promote comfort to the patients and maintain the body alignment, and it will promote immobility of the body parts, and this will increases the pressure points and reduces the pressure points of the patient body parts, and this will prevent the fall and accidents of the patient. So next we'll see first topic, that is backrest. What is meant by backrest? Backrest, it is a mechanical device that will helpful for keeping the rest the back during the supine position. So what are the purposes of the backrest? So backrest, if you see, this will promote comfort for the patient, and this will ease the breathing pattern of the patient. Mainly we can see this can be provided for the cardiac patient and asthma patient and chronic COPD patients, and this for post-operative patients also. Second one is sandbag. Sandbag, this is the device that is canvas or formed of rubber or the plastic that is filled with the sand, and this will be keep on the rest of the foot. So what is the purpose? Means comfort for the patient. Second one is this will promote the support for the foot. This will promote supportive for the operative side, and this will maintain the position of the foot and prevent the foot drop of the patient. So next we'll see air and water mattress. Third point is air and water mattresses. Air and water mattresses are the mattresses that is filled with air or the water. This will prevents the pressure in a particular area. The pressure will be equalized all over the parts. So this will maintain a proper comfort for the patient. So what are the purposes? Mainly first one is relieve discomfort of the patient, and this will go with increases the circulation, blood circulations, and this will increases the pressure sore, comfort for the pressure sore. And if you see, this can be used for a lean patients or the obese patients, and this can be used for the chronic bedridden patients, okay, mainly to prevent the decubitus ulcer. So next, if you see, next one is bed cradle bed. So cradle bed, mainly if you see, this is a varieties of wide, and mainly top of the bed will be covered with wooden or electronic or metallic type. Okay, so this mainly if you see, this will take off the weight of the upper part of the bed. And what is the main purposes? This is mainly used for the patients of the burns patients. The top covering will not come and touch with the upper part of the burns patient. The next, it will be used for covers the head, and if they have the plaster of Paris for the drying purpose, and for the electrical electrical bed cradle can be used to give a warmth for the patients who are in a shock. So these are the main purposes of this bed cradle. So bed cradle mainly if you see semicircular in shape. And if you see foot board mainly to rest the food of, if you see two types are there, like sandbags are there, footboard are there, for the comfortable of the patient to rest the foot and to prevent the foot drop. Next we'll see what is cardiac table. Cardiac table, it is one of the device that is placed over the bed. So even the patient is in supine positions, they can use the cardiac bed. What is the main purpose? Main purpose, after the post-operatively they can use, and the patient is lean forward as a propped position, and they can go with self-care activities like providing the meals in the cardiac tables. For the cardiac patients, for the writing purposes, self-care activities can be done by this cardiac tables, and this can be used for post-operative cases also. So next we'll see trapezius bar. So this is a triangular shape bar that is placed over the overhead frame, overbed frame, and this can be used for the comfortable of the patients. The patient can hold this and they can pull up the trunk from the bed, and they can use the upper arm exercises can be done, and this can be used for movement of the patient from bed to the wheelchair, and some procedures, nursing procedures can be done with the help of this comfort devices, and if they go with any other procedures also, they can use this handle and they can do it. Then next one is trochanter roll. Trochanter roll, if you see, this is a cloth that can be folded, and this can be placed and extended from the femur, trochanter part of the femur to the popliteal space, and this will prevent the external rotation of the leg during in the supine position. Then next we will see bed block. Bed block, or this is like a wooden or metal type of block that is present kept on the foot end or the head end part of the bed. So this mainly what is the purposes means, after the post anesthesia can be done, and this can be prevent for the shock features or the hemorrhage, and trundle positions can be done, and for the comfortable positions after the post operative. So these are the major functions of the bed blocks. Okay, then next we will see one is cotton ring. Cotton ring, that is a rubber ring that is covered by the bandages. This can be used as a comfort devices that is present on the pressure points. Mainly the purposes is this will maintain the pressure points and comfortable for the patient. So next we will see about the hand roll. Hand roll, that is a cloth that is folded and rolled over the hand and fixed by the and it can be fixed. So this will maintain the flexion of the fingers, abduction of the fingers can be maintained. And next one is air cushions. The air cushions are filled with the air, and this will be covered by a cloth and can be placed on the patients, that will promote the comfort and maintain the pressure points in a proper manner, and easier for the patients. Next we will see the pillows. Pillows are the comfortable devices which will promote comfort for the patients, and it can be placed on the head, neck, and limbs, and various parts of the body. So what is the purpose? Mainly post-operatively we can use, and this can be reduces the pain of the patients. This can be placed under the knees, under the hip, and after the surgical regions, and so these are the main purposes of the pillows. Next we will see that is form of that is the foot and elevator. So foot and elevator, this is like transportation devices can be kept vertical and the raised manner, and this can be placed on the foot in order to make a position of the foot for the transportation, and this can prevent the foot drop, also support the feet and the ankle. And these are the major comfort devices that comes under the comfortable purposes for the patients. So hope you have understood the class. We will meet in next video.